14 fresh COVID cases have been detected in Assam, taking the total number of cases to 135. Of the 14 new cases, 7 are from Kamrup, 2 each from Hojai, Biswanath and Nalbari, and 1 from Nagaon. 6 more cases were reported earlier in the day, of which 2 cases each were reported from Jorhat and Golaghat districts, while there was 1 case each from Kokrajhar and Nagaon. So this makes it 20 cases detected in a span of an hour in Assam. The total active cases now have gone up to 88. Yes, viewers, a big story at this point of time. 14 fresh COVID cases have been detected in Assam, well, taking the total number of cases to 135. Of the 14 new cases, 7 are from Kamrup, 2 each from Hojai, Biswanath and Nalbari, and 1 from Nagaon. 6 more cases were reported earlier in the day, of which 2 cases each were reported from Jorhat and Golaghat districts, while there was 1 case each from Kokrajhar and Nagaon. So this makes it 20 cases detected in a span of an hour in Assam, while the total active cases now have gone up to 88. All right, viewers, our editor-in-chief Wasbir Hussain joins me live at the moment. Well, Wasbir, as many as 20 cases reported in just over an hour. The numbers clearly are rising rapidly since the last 2 days.
Well, yes, Priyana, you are absolutely right. 20 cases in the last 1 hour or a little more than that is really something which is a cause for worry. But I would still say that there is no need to panic, because of the 14 new cases which had just been a few minutes ago, which had just been declared by the State Health Minister, Dr. Himanta Biswa Sharma, all the 14 cases, including the 7 from Kamrup, were actually people who were already in quarantine. Let me tell you, the tweet which has come from Dr. Himanta Biswa Sharma, the Assam Health Minister, a few minutes ago, which says 14 new cases, 7 from Kamrup district. All the 7 were at the quarantine center in Hojai. In fact, they had come from places like Haryana, Mumbai, Rajasthan, and so on and so forth, and they were quarantined. And similarly, all the cases in Hojai, Biswanath, Nagaon, Nalbari, these are all people who are in quarantine. That is the only silver lining. So I would say yes, cause for worry, but certainly not a cause for panic, because these were people who were already in quarantine. Therefore, Priyana, what the Assam health authorities, led by the health minister, Dr. Himanta Biswa Sharma, has been emphasizing in the last few days is that the biggest challenge is to enforce or ensure a proper quarantine of the people. The quarantine has to be taken extremely seriously, whether it is institutional quarantine or whether it is home quarantine. It has to be enforced strictly, and the responsibility lies as much as with the individuals as with the state authorities. Priyana.
Right, Wasbir, rightly said. As over half of those texting positive have travel history, is it extremely important to regulate entry, like what the Health Minister Himanta Biswa Sharma had suggested yesterday? 500 people entering the state every 3 days, maybe.
Well, yes, there was an appeal. You see, you cannot prevent people from coming home. That is also something which the state has realized. But despite that, the authorities, including Health Minister Dr. Himanta Biswa Sharma, has been trying to make the people understand, try to drive some sense within the people. They've been appealing to the people to come home, come to Assam in a staggered manner, not at a time. So that becomes, screening becomes difficult, quarantining them becomes difficult. It leads to a lot of logistic issues. Therefore, people outside must get in touch with the authorities, wait for the allocated time and come accordingly. So that will help them get better treatment and also save the state and its citizens from the brunt of this virus. But as I have said, I think there is still no trace, no case. It's not a case of community transmission. That is the silver lining. Most of these people who have tested COVID positive in fresh are people who are already on quarantine. So that is the silver lining, I would say, at this point in time. Priyana.
Right, Wasbir, due to some relaxation, well, the irony is that there are maximum activities in cities, which are going on when cases are actually rising right now. Last 60 days wasn't that purposeful as it is important now. Right.
Absolutely. This is lockdown 4 going on. The government has given a lot of relaxations to the lockdown
Right.
so that there is no economic meltdown, so that people are not in crisis due to lack of business activity and lack of food to eat. So considering this taking this into account, there has been given a lot of relaxations. But as I said in the beginning, the responsibility lies with the citizens, lies with the people. Unless people are extremely required to go out, I think all the elderly people above 60 and 65 should remain indoors. Children below 10 should not venture out. So these are some of the things which the people have to follow strictly. And those who do have no official work or business or medical emergencies should not venture out of their homes. This will give a lot of relief to the health workers, a lot of relief to the authorities, and of course protect their own lives as well as the life of the fellow citizens.
Right.
So our appeal from Northeast Live will be stay indoors, don't go out unnecessarily, and it's a cause for worry but no cause for panic yet.
Well, rightly said, Wasbir. Thank you so much for joining us and giving us your thoughts on the matter.